Today on a special edition of Brian Ross Investigates. Lessons to be learned. In Taiwan, they're playing baseball. Restaurants are open, and so are the schools.
So when kids go to school, they have their temperature taken. If they have fever, they can't go to school.
In a country of 23 million people, so far only 6 deaths from COVID-19. And now they're sending the U.S. millions of masks they don't need. Plus, your questions about COVID-19 and the law. Your job, your home, your rights.
We'd like to know what rights we have.
What do you suggest we do?
From the Law&Crime Network, this is a special COVID-19 edition of Brian Ross Investigates. Welcome, and thank you for joining us. This is Brian Ross, and this is a special report from the Law&Crime Network and for our viewers on YouTube Live and Facebook Live. I'm joined today by my colleague at Law&Crime, Rhonda Schwartz, the executive producer of this program. And Rhonda, this week we're seeing a lot of counter currents here. The country is still grieving, still suffering from everything that's happening, yet there's a big push for states to reopen as if nothing was going on.
Remarkably, the governor of Georgia said he was going to allow the reopening of tattoo parlors, hair and nail salons, billiard halls. At first, President Trump agreed with him. Then he turned around and said, no, it's very hard to know what's going on.
As it is for people across the country, there are all sorts of protest movements as they try to liberate their states. Here's some of the stories that were being played out today across the country.
Day after day, we're seeing back-to-work protests breaking out, some larger than others.
Pennsylvania's capital, the frustrated crowded together, few with facial coverings, to protest the state's stay-at-home order.
I'd rather be working. I really would, and I really wish they would open this up.
In San Diego, demonstrators showed up waving flags, holding signs, voicing the same demands.
It's not fair to the rest of us that don't have COVID-19. We all need to get back to work.
In Denver, Colorado, this is what happened when a nurse stood at an intersection to block protesters to remind people of the human toll of all this.
Protesters are saying enough is enough. People want to go back to work, they can.
This whole thing was a mistake from the beginning to shut down America.
There are families hurting, there are businesses hurting. We can't pay our bills.
Many of those protesters across the country say for them this is about civil liberties, but at the end of the day, a lot of it is also about jobs.
So let's get to your questions about all this. I'm joined now from Los Angeles by Angela Reddock-Wright of the Reddock Law Group, and from Annapolis, Maryland, Joyce Smithy of the Smithy Law Group. And Angela, let me start with you. When you watch all this, what rights do these people have if they want to demand their jobs back, go against what the federal government is saying?
Well, first, Brian, let me just say it's really sad to see our country so divided over this issue, because in the end, what our many of our government officials are doing and employers are doing, they're trying to make sure that the environment is safe for everyone. So certainly the protesters and others have the right to protest. There's freedom of speech, there's freedom to protest. And I understand that many people are suffering beyond just having cabin fever. You know, as one of the viewers stated, that it's about jobs, it's about getting back to work, and that's certainly understandable, but we have to make sure that we create an environment that's safe for everyone to go back to. And that's ultimately, in my opinion, what the decisions are about for our governors, for our mayors, and for our elected officials and employers.
Joyce Smithy, a question from one of our viewers, actually is a doctor, wants to know about his rights with an employee who won't come to work. Take a look at what he asked.
My question involves an employee from my office in Brooklyn who has chosen to not come into work because of fear of the coronavirus. We remain open and there is work for her, so I'm just trying to figure out what my responsibility is legally at this point. Am I responsible for unemployment, etc.? I'm not sure, so please can you address that? And then as a follow-up, can you explain to me what the meaning of a furlough is? And I've heard that bandied about, but I'm not sure what that means and how that fits into what's happening in my office. Thank you very much.
So Joyce Smithy, what's the best answer to the doctor's question?
Sure. So healthcare providers have limited rights as employees right now. They've been exempted from the Families First Act. So you have a right to expect that worker to come to work. I would say the exception would be if they are in a high risk category because of a disability, like diabetes. They may request an accommodation not to come into work. But other than that, the law doesn't give a lot of protection to healthcare employees or rights about not coming in. And if you require them to come in and they resign, that's going to disqualify them very likely from receiving unemployment benefits.
So many questions about these issues. Angela, a question for you from Rhonda Schwartz.
We've heard from a lot of viewers who want to know, I'm afraid to go to work. Am I going to get fired? Are they obligated to give me protection? What if I'm afraid to go in, and will I be liable?
Great question, and that's at the heart of everyone's mind. As Joyce indicated, if you're an essential worker, there will be a challenge with your being able to say you can't come into work unless you've tested positive for the virus or you're taking care of someone with the virus. But if you are classified as a non-essential worker and your state or your city has a local order or law in place that prevents you from going to work, then for sure you are protected. And if you feel that your employer is not providing a safe environment, that is not sanitizing, that is not creating a situation where there's social distancing, then you definitely have a right to protest going into work. And if your employer requires you to come into work, then you possibly have claims related to retaliation, or you may be able to hold your employer accountable in some other way. But if you're non-essential, there's no absolute requirement that you go in.
All right, Joyce, a question for you. You follow what happens in Washington all the time. The president's economic advisor, Larry Kudlow, is saying there should be a law that exempts all employers, everybody, from any liability out of this COVID-19 crisis. What do you make of that? Is that something that could actually happen?
Yeah, I've seen crazy things happen, but that would really surprise me. Employment cases, are difficult to prevail in as it is, and I think stripping all rights away from workers to give absolute liability absolutely freedom from liability seems very unlikely to me. I think the spirit right now is to protect employers and employees, and I think it's unlikely we'll see legislative bodies throwing one aside. I think they're striking that balance very carefully.
All right, Angela, a question from one of our viewers. Is it too late now to apply for a small business loan under PPP, Paid Protection Program?
It is not. In fact, Congress right now is considering the second stage of the federal stimulus bill, which will include an extension of the Paycheck Protection Act, or the PPP, as many have been referring to. So the best thing is to find a lender, preferably your own bank or another bank or community bank. Make sure you have your application and all the required documentation in place. Rumor is that this next leg of the federal stimulus bill will extend more money to small businesses, whereas there was a lot of criticism from the first round that it primarily went to large employers and large organizations. So hopefully this time we'll see those funds funnel down to smaller businesses and independent workers and contractors.
Exactly. We've seen some of those loans go to very big restaurant chains and small mom and pop operations getting short shrift, right, Angela?
Right, exactly. And there's been a lot of criticism of that in the news this past week. Some companies even returned the funds, stating that we don't need them, such as Shake Shack, and to use the funds for businesses and companies that really need them.
All right. If you're just joining us, you're watching a special report from the Law&Crime Network, and for our viewers on Facebook Live and YouTube Live, COVID-19 and the law. And Rhonda Schwartz, as the U.S. is debating what to do, some countries are already planning to go back to normal. Germany's taking first steps, and New Zealand too, right?
New Zealand has already told its citizens that as of midnight Monday, They're going to go to what they're going to step down the alert so you can start to get ready to open businesses and schools. They're going down one level and they've published the golden rules of what to do for the next 2 weeks. They're moving towards opening up.
Right. And no country has done better than Taiwan. So far, in a huge country, only 6 deaths out of 23 million people. And I talked to Dr. Jason Wang, a native of Taiwan, who's now the director of Center for Policy Outcomes and Prevention at Stanford University, about why Taiwan was doing so well. Dr. Wang, thank you so much for joining us. Let me get right to the point. What is Taiwan's secret of success in the midst of this COVID-19 crisis?
Yeah, I think what Taiwan has done this time is that they were prepared and they recognized the crisis really early and they took quick and decisive action. They also managed their resources very well in terms of protective gear so that frontline healthcare workers have them. And then they took more actions than just controlling the border. They provide help to businesses and individuals affected by the virus. And so overall, I think it's going well for them so far.
So far, in a country of 23 million people, only 6 reported deaths. That's just astounding, isn't it?
Yeah, I think it's a remarkable result so far. So I think they need to continue to be vigilant to stay that way. Yeah. And
we see baseball is back without the crowds, but there's some attempt to get back to normalcy in Taiwan.
Yes, in fact, in Taiwan, schools are open. So when kids go to school, they have their temperature taken. If they have fever, they can go to school. They wipe down their desks. There are dividers in between the desks. And every kid is given a mask every day to wear. And they are taught to wash their hands constantly, singing 2 birthday songs. And so, the kids are learning physically in school. Workplaces are open. And the same thing, in these workplaces, they have sanitizers everywhere. So before you push the elevator button, you use the sanitizer. People wear masks. They also get their temperature taken, and people start to try to do social distancing. Stay 2 meters. That's over 6 feet in between people. And so restaurants are open, but some of the restaurants remove half the desks, have the tables, so that naturally then you get more space in the restaurants. But you still have to open your mouth to eat. So that's something you can't overcome with masks.
Well, that's exactly what did not happen, at least initially, in the United States. Let me go back to one thing you said about the schools are open. Is there a danger in the children moving the disease around, getting it at school, taking it home?
Yeah, so that's definitely a potential risk. But because they've done contact tracing very well, so that they know family clusters, and so far so good. Again, if a child has been exposed to a COVID-19 patient in a class, for example, in a classroom, if a child has been in contact with a COVID-19 patient, the class will get canceled, that class. If 2 kids in the same school, the whole school will be suspended for 14 days. So they are monitoring the situation as it happens. And because they check people's symptoms every day. And, kids sometimes have mild symptoms, right, or no symptoms. So there's still potential to do that. But like I said, you have to have a good data system. And in our country here, because we're so big, we're much bigger, and we have 50 states, and a lot of the power are within states. And so each state, I think, needs to get organized as if it's a country, like Taiwan. But then it needs to coordinate with the central government on some of the activities. So you make sure that you're moving forward together with the federal government. I think it's both a responsibility of the states and also the federal government provide the right type of guidance.
Right, absolutely. Well, Dr. Wang, thank you so much for joining. I think there's a lot to learn for America from how Taiwan has responded to this.
Thank you very much, and best wishes to you and your audience.
Let me ask our panel, Joyce and Angela, what do you make of that? Could those same precautions and steps work in this country, Angela?
Well, I really admire what the doctor said about Taiwan and the fact that the entire country, the federal government and the various states and local jurisdictions were able to unify around one mission, a mission that protected the economy and also that protected workers and protected students even. And so I think that's the key for us to be able to open back up as an entire United States. Our government needs to unify across the board and think about all of the stakeholders and all of those who are interested and think about how we protect everyone while also bringing back our economy. It's not hard. It's not hard. It just requires unification and a desire to want to do right by all American people.
And Joyce, Dr. Wang also told me that Taiwan was lucky because this time there's no election underway. The last time they had the SARS epidemic, there was an election and politics got in the way. But in this country, Joyce, we're seeing a lot of politics get in the way.
That's absolutely true. And if everybody could just step out of the way of politics and listen to those who know more about this than we do, I agree very much with Angela and admire what the doctor said. I think if we can all get in this together and, put the politics aside, we can get to a version of normal more quickly. You hear everybody worried about a second wave and the risk if we open up too soon. And certainly we know history from other pandemics, those second waves can be worse than the first. So putting politics aside, listening to the experts, if we can all do it, hopefully we can see a version of normal sooner rather than later.
All right, Angela, another question from one of our viewers about her rights, what she can do. She sent in this video. Take a look.
Hi, I'm Abby. I'm a direct support professional. I deal with individuals who have intellectual and developmental disabilities. I also have lupus, and my work gave me one mask over a week ago, and we're not being told when we're going to get more. I've also had to wear that mask on grocery trips as well. My concerns are, what should someone in my situation do who has lupus when their job doesn't offer hazard pay or sick time? And very easily a carrier who has no symptoms could walk into one of my homes. I guess, what should I do in that situation? To protect myself and my family, if I'm not being offered the things that I need. I've been wearing the same mask, and I might as well be wearing nothing.
So Angela, Reddock-Wright, what would you say to our questioner?
Wow, what a difficult situation. So it sounds like she's possibly considered an essential worker because she works somewhat in the healthcare industry. So first, I tell this to anyone on any issue. Start with your human resources department. Let them know what the problem is. Let them know that you are more susceptible because of your own medical condition, and see if they're willing to work with you to provide you either with the protection you need while working or to give you a leave during the time that this epidemic is at its height. If you're not able to work through your human resources department, then certainly you should continue to request protective equipment and possibly even bring your own and ask for reimbursement from your employer for bringing your own, or consider possibly whether you could qualify for disability or for some type of paid sick leave within your state, and consider taking time off until the pandemic passes and you feel more comfortable and safer in going back to work. But start with your human resources department, and hopefully they'll be willing to work with you.
All right, and a follow-up question to that, Joyce Smithy. What about possible hazardous duty pay for essential workers who aren't police officers or firemen, but are stocking the grocery shelves and driving the buses?
Sure. I've been saying to people, I wonder when this is all over, whether we'll remember to appreciate these essential workers as we should. Hazard pay for these essential workers would have to come from a legislative place. And if the legislature considers that, I haven't heard anything along those lines to consider something like that. So I don't know if that's being considered on a federal or state level, but that's where it would have to come from. I know there's an awful lot of appreciation right now that I hear from everywhere So I won't rule it out as a possibility, but unless there's a legislative initiative to do it, I don't think it's going to happen.
All right. Now let me follow up and ask you, Angela, how long will unemployment benefits last in this current environment?
Well, there are two things. There's the traditional unemployment benefits that individuals receive through their state EDD or Employment Development Department. And then the second piece of it is part of what the CARES Act did is it expanded unemployment benefits and provided states additional funds to be able to provide not only employees, but also independent contractors and gig economy workers with unemployment benefits. And is adding an additional $600 weekly benefit on top of what individuals receive from their state. And then on top of that, it provides an additional 13 weeks of unemployment benefits once your traditional state benefits run out. So those benefits are retroactive back to January 27th, 2020, if you were laid off or terminated within that time period. And it currently goes through the end of July, in addition to 13 weeks on top of that. So we're looking for at least, another 6 months or so. And then I imagine that this current bill and possibly future bills will extend benefits beyond that.
All right. And Joyce, time for a quick question, 30 seconds for you from Rhonda Schwartz. Rhonda?
So if you get laid off in this current environment, what should you do to protect your rights in the hopes of getting your job back when this is over?
Sure. So certainly if you get laid off, which is different than a furlough is the idea that the employment relationship hasn't ended and you're coming back. If you're laid off, certainly call unemployment. Angela just gave a great description of the enhanced benefits that are available. And then from that standpoint, stay in touch with your employer. We've got the Paycheck Protection Program out there that's allowing a lot of small employers to bring people back, and they have deadlines to meet their head count. So stay in touch. There's some incentives out there for employers to bring you back, even if you were laid off instead of furloughed.
All right. Joyce Smithy from the Smithy Law Group and Angela Reddock-Wright from the Reddock Law Group, thank you so much. And thank you, Rhonda Schwartz, for joining us. Jesse Weber will be here tomorrow, and then we'll be back next Tuesday. I'm Brian Ross, reporting from my remote studio in Connecticut. Thanks so much for joining us. Stay safe, and we'll talk to you soon.